My name is Michelle Horspool. I'm the Deputy Director for Research for Sheffield Health and Social Care Trust. I also lead the evidence-led theme of the Clinical and Social Care Strategy with John Burley, who's the Clinical Effectiveness Manager. So one of the 4 themes of our Clinical and Social Care Strategy is around being evidence-led. And being evidence-led really means using and generating evidence. So that's using evidence to inform the care that we're giving, to inform our decision making, to help us understand what is working well and what isn't, but also to ensure that our services and the care that we give is the best that it can be. So evidence really is just information, but it's information that's collected in different ways and from different sources, and it's used for different purposes. So we need to use the right evidence at the right time for the right purposes. So evidence can help us think about what works well, for who, and in what circumstances, and it can help us to improve the effectiveness of our practice and service delivery. So I mentioned about using and generating evidence, but what does that really mean? So when we talk about using evidence, we think about using different sources of information to help us inform our decision making, and that can be things like data, it can be NICE and other clinical guidelines, it could be research, but it could also be patient and service user and staff experience. So we then need to generate evidence so that we know that what we're doing is having an impact. And the sorts of things that we can do there is we could do clinical audit, we could do service evaluation, we could do some research. And what this will tell us is what we're doing well, whether we need to do improvements or whether we actually just need to stop doing something that isn't having any impact whatsoever. And this is really essential for making the best use of our resources and delivering the best care that we can. To be able to monitor and evaluate kind of what we're doing, we also need to have really clear and measurable outcomes so that we know what we're actually trying to achieve. Otherwise, we could potentially just be kind of going round in circles. And these can be service level outcomes or they can be patient reported outcomes.
My name's Alix Smith and I'm the Clinical Outcomes Lead working in Sheffield Health and Social Care, and I'm working on the implementation of patient reported outcome measures across the Trust. These are measures that can be used to measure particular outcomes identified by services, but they can also be used to identify areas of an individual's life that are important to them and help direct the focus of personalised care and support planning. NHS England have recommended the use of 3 PROMs. They each measure different aspects of an individual's life. The ReQual 10 is a quality of life measure, measuring thoughts, feelings and activities over the past week. The Dialogue Scale is measuring areas of wider social need, and the Goals-Based Outcomes tool pulls them all together to help develop up to 3 priority goals to guide the direction of care. Each of these measures are co-produced and they are empirically validated tools. They've been tested with a range of different client groups and different mental health care settings. They are available in different languages, translated and also tested for their cultural sensitivity and acceptability by service users. So what does this actually mean? It means that we are putting our service users back in the driving seat of their own lives. We're providing them with a sense of agency to guide the direction of their care in the direction that they would like to travel. We're providing evidence to measure an individual's progress and map out their journey across services. We're providing evidence for clinical teams to enable them to measure the quality of the work that's taking place, identifying what's working or what's not working, and ultimately helping clinical services celebrate their successes. The data that they will provide will give us information on an individual level, as well as a team level and as a trust. So we're being more evidence-led in our practice.
So if you're a staff member, we have support within Sheffield Health and Social Care Trust that can help teams to understand what this all means, and so that we know that we're delivering the sort of best care that we can to the people that use our services and their families. The Research and Evidence Hub is a partnership of multiple teams that can help you to kind of work through what it means to be evidence-led and provide you with the support that you need to do that. You can visit our page on Jarvis, or you can email us at evidence@shsc.nhs.uk.